Good morning. Natalie Cohen here. I am the Senior Marketing and Community Relations Associate for Walden Behavioral Care, and I also do a lot of all the social media for Walden Behavioral Care. We are super excited to be here with Kate Craigen. She's the newly appointed Clinical Director for Binge Eating and Bariatric Support Services. So we're super excited to kind of interview her today and introduce you all to her. So we have a few questions and we'll get started. If anyone has any questions as we're going along, please feel free to write in. I know that this is also going out to providers in the community, so feel free to email Walden at info@waldenbehavioralcare.com, waldeneatingdisorders.com. So also like or comment in the info section, and we'll be sure to try to answer your questions as we go through. Okay, so Kate, congratulations on your appointment.
Thank you.
So can you briefly talk about your new role and kind of what it's like to, what your new responsibilities are?
Absolutely. So I'm primarily responsible for overseeing the programs that are treating people with binge and emotional eating at all levels of care here at Walden.
Mm-hmm.
So that involves program development as well as supervision of the clinicians who are treating this population. I will also be collecting data as we go to make sure that our programs are effectively treating this population and to make any changes that are needed based on the feedback that we receive.
Great.
Also part of my role is coordinating the program development and collaboration with people who are seeking out or have just recently undergone bariatric surgery. And I am responsible for collaborating with the surgery centers in the area to see how we can help them and what we can offer.
Great. What are you most excited about in this new position?
Well, I actually think it's very exciting that Walden has created this position. It's a new role in the company, and it really reflects Walden's dedication to the treatment of binge eating. And really right now we know that there are millions of Americans struggling with binge eating disorder in the United States, more than the other eating disorder diagnoses, around 4 million women and 2 million men. And ultimately I see that as then being my responsibility to do everything I can to design services that are going to reach as many of those people as possible, and to be as innovative as I can to offer as many options as we can here at Walden for that population.
There's been a lot of kind of increased binge eating disorder hype, almost like I'm seeing it all over the internet, and there's commercials everywhere. It's almost kind of everywhere, especially in the media. Why do you think that is?
Well, we've known about binge eating disorder for a long time. We've been studying it for years and years. However, recently, the diagnostic manual that mental health professionals use has recently recognized binge eating disorder as its own separate, distinct diagnosis. And this, I think, has...
And previously it was
encompassed in what we call eating disorder, not otherwise specified. So it was certainly a diagnosis that was up for further study, but we finally had enough research to support making it its own diagnosis. And so as a result, I think it makes it easier for researchers to study it, so we get a lot of great data that way. And having its own diagnosis also makes it easier for clinicians to recognize. So I would say that...
And insurance providers to recognize.
Absolutely.
Yeah.
Absolutely.
Awesome. How has the understanding of binge eating disorder evolved over the past few years, and also how has it impacted treatment therapies that are available to patients who are struggling?
I think that the treatment options that have existed for binge eating disorder in particular, right now they're really moving in the direction of addressing the ways in which emotional life events trigger binge eating episodes. And so there have been these pre-existing treatments which really are great at addressing greater understanding of your emotions and thoughts and the way that they lead to or trigger certain behaviors. And we've been doing a lot of research into applying those existing treatments for the treatment of binge eating disorder. And we know that once people have better awareness of some of their own patterns of behavior, those thoughts and emotions that lead to binge eating episodes, puts them in a much better position to be more in control and choose a different path that is not binge eating.
Correct, right. Okay, gotcha. So briefly talk about the program that we offer here at Walden, and how does it differentiate us from other types of programs or other treatment facilities?
Right. So I do want to make the differentiation between Walden and typical sort of weight loss programs. I think we see quite a bit. We hear from our patients and the individuals who come to work with us that they have tried for years on and off many different dieting and weight loss programs. Sometimes they have had some short-term success and that maybe the binge eating behavior stopped, or maybe there was some change in weight that they were looking for, but frequently those outcomes were very short-term and short-lived. So what we are really focusing on here at Walden is the binge eating behavior. We want to help patients really rid that behavior from their lives. And we recognize that a lot of the people we work with are still holding on to a goal for weight loss, but they also recognize that historically the binge eating behavior has really sort of sabotaged any efforts along those lines. So we recommend focusing first on the binge eating, and then we are able to make recommendations to people for healthier ways to lose weight, especially with the help of professionals who are familiar with eating disorders and binge eating disorder in particular. I think that one of the other things that really distinguishes Walden's eating disorder program for binge eating disorder from the other eating disorder treatments that exist is the company's commitment to evidence-based treatment. So that's kind of a fancy way of saying that the treatments that we are using here at Walden have been scientifically studied and shown to be effective in helping people who are struggling with this disorder. We particularly have designed our curriculum based on the cognitive behavioral therapy for binge eating, interpersonal psychotherapy, and dialectical behavior therapy. So some treatments work better for some people than others, and we've really pulled components from all of those treatments into the care that we provide here at Walden.
So that it's very individualized and kind of catered to each person and what they need.
Absolutely. Yeah. I think the other great thing about treatment at Walden in general is that we can provide treatment for binge eating for the full spectrum of care. So we have outpatient treatment, which is your more classic individual therapy, nutrition, counseling, medication management, and then we have our evening intensive programs, and we can also provide day treatment, residential treatment, or inpatient treatment depending on what people need. And at Walden, we work with people to figure out exactly what that is, to figure out exactly what will meet their needs in the moment.
Awesome. What are you enjoying? So, I know it's been recent appointment, but what are you enjoying most about your new role?
Well, I love teaching and supervision, and those are big parts of my role. Teaching, I do both in the context of running groups in the program, but also teaching staff. So it's a really huge goal of mine to make sure that the staff that are working with this population here at Walden are well-trained and they feel competent and confident to deliver the groups that they're delivering and make the recommendations that they're delivering. So that I am very much working closely with clinicians at all of our levels of care in all of our clinics across the company to make sure that I'm connected in that way.
Okay.
So that's been really exciting.
Yeah.
Another great part is I've been working with marketing quite a bit.
Yay!
And that has really offered me the opportunity to brainstorm with your marketing team about all the different ways to reach people who are struggling with this, because certainly education and awareness is a main goal for us here at Walden, and I've had a lot to do with that, which has been great.
That is awesome. It's really interesting kind of like what social media has been able to do for like being able to reach the population that we need to reach, so the consumer.
Yeah.
So that's really interesting. Thank you for saying that. What is the message for those facing binge eating disorder, emotional eating, or what is your message, or related conditions?
So people who identify with binge eating, compulsive overeating, food addiction, these terms tend to carry with them years of feelings of shame and guilt related to those eating behaviors. Those emotions can be very heavy and certainly can affect lots of different areas of life. And I think that what my message, or one of the things that I want to say, is that it's an enormously difficult step to recognize that you need help with something and to actually ask for that help. But once you've made that leap, and certainly, once you have come to us here at Walden, we have many different really effective treatment options for you. And this disorder is treatable. there are things that you can do, changes you can make, hard changes. There's a lot of hard work, but the hard work is well worth it. And we see people making change, feeling that change, and feeling so much better once the binge eating behaviors are gone.
Your new role also encompasses bariatric support services. So what does that look like?
So we at Walden here are interested in providing support to people who are getting ready to undergo bariatric surgery or who have recently completed bariatric surgery. And I think, based on the skills that we teach and the education that we provide about emotion regulation and using coping skills other than food, puts us uniquely in a position to provide support to this population. So we are designing programming specifically tailored to this population, and we are also reaching out to surgery programs in the Massachusetts and Connecticut area to provide this, to really collaborate and provide this behavioral health component, which is so important for successful surgery outcomes.
Okay. So we're very excited that you're going to be presenting a bunch of a series. We have a spring speaker series every spring. So we're really excited you're going to be doing that. Can you talk about that and where you're going to be and what you're going to be talking about?
Mm-hmm. So as you mentioned earlier, there's a lot more sort of in the news, in the media. We hear a lot more about binge eating. Mm-hmm. As a result, more people are recognizing that this is the name for the thing that they have been struggling with for years.
That's exactly it. Yeah.
So what we have heard, right, is that there's a lot more people presenting, to their providers saying, I think this is something I'm struggling with. And so we invite all different types of providers to come to these speaker series. And really what I am hoping to convey is some of the most important core details about the diagnosis of binge eating disorder, typical course of illness, risk factors for developing binge eating disorder, and the different treatment options that currently exist. So my hope is that those things will all be takeaways from my presentation.
Awesome. And I think also it's important to note we've gotten an overwhelming response of people interested in coming to see these presentations, and I think it just speaks to how kind of relevant it's becoming in people's practices and how they're feeling like they're feeling the pressure to be able to reach this population of people and treat them accordingly. So I think it's interesting.
Yeah.
If providers or anyone is interested in learning more about binge eating disorder or the programs that we offer, where can they go? What are the resources in the community?
Yeah. So I've actually worked very closely with the marketing department to make sure that the materials that we are presenting on our website are accurate, informative, and helpful. So waldeneatingdisorders.com is a great resource to anyone looking for care, wondering about treatment for loved ones, or providers who are looking to get in touch. So contact information on how to reach us here at Walden is all on that website.
So thank you so much. We're really excited to have you on board. I mean, she's already been here and done amazing things with our patients, but in this new role, we're super excited to welcome you.
Thank you.
And thank you everyone for watching. Please let us know if you have any questions, and feel free to contact us, waldeneatingdisorders.com. Thanks so much. Take care.